The main topics are radiation exposure and monitoring, handling and disposal of radioactive material, image evaluation, and technical evaluation. Radiation exposure and monitoring. Dosimetry is a calculation of the absorbed dose in tissues resulting from exposure to ionizing radiation. These badges provide readings about the dose of ionizing radiation an individual receives. Some personal dosimeters are optically stimulated luminescence is the most accurate dosimeter. It can detect radiation as low as 1 milligram. Its main component or filter is aluminum oxide. Another one is thermoluminescence is mainly to measure gamma, X-ray, and beta radiation. It can be body badges or bands. Handling and disposal of radioactive material. Storage and disposal of radioactive waste is strictly regulated. All radioactive waste must be transferred to environment, health, and safety for disposal. Do not dispose of radioactive waste in regular trash cans or pour it down drains. Storage guideline. Separate all waste by isotope and physical forms. Designate a specific location for the storage of radioactive waste. Attach and complete hazardous waste stacked to each container in the radioactive waste storage area. Keep containers closed except when material is being added. Make sure the container and bag exteriors are free of contamination. Request hazardous waste collection when you're ready for a waste pickup. There are different types of radioactive waste. One of them is liquid waste, solid waste, and gaseous waste. There are collections of radioactive waste. It can be sharpened containers, plastics bags, lint bins, or labeling and packing. This means that when you dispose them, you have to label and pack them properly. Image evaluation, identification. First, check the image identification. It is clear and complete. Does it match the identification on the requisition? Anatomy. Is the pertinent anatomy included on the projection and clearly visible? Was the patient properly positioned? Look for evidence of rotation or superimposed structure for indicate improper position. Another step for image evaluation is aesthetic consideration. Does this image have aesthetic merit? Do artifacts or other features of the image detract from its general appearance? Also, radiation safety. Is there evidence of collimation on at least 3 markings of the image? Were appropriate or shielding parent and correctly placed? Identify the cause of the problem noted on the image. They are so significant as to require the image to be repeated. If so, what changes are necessary to repeat the image to be successful? Technical evaluation. MAS is the product of MA, milliamperes, and exposure time, that means seconds. kVp is kilovoltage peak. It controls the contrast of an image. Recorded detail, aka resolution, sharpness, definition, and spatial resolution. Distortion is the misrepresentation of size and shape of an object. Contrast resolution is the ability to distinguish many shades of gray from black to white. Collimation is to restrain or limit the X-ray beam to a particular area. Beam restriction is used to limit the field size useful to reduce those of the body.